I think as Dr. Khalid is asking about the American experience, I think we can ask Dr. Mike for his help about this. Dr. Khalid, Professor Dr. Khalid Samir is asking actually about the American experience when they started to shift or to start the concept of urgent care service and centers there. Did you face any difficulties with the patients, with the American patients, to shift them from the emergency departments in hospitals to go to the urgent care centers? What about the resistance at that time?
At that time, we didn't really see much resistance from the emergency centers because many of the urgent care centers are partnered or paired with urgent care centers, so that if there is an acute case that comes in, there's already a preset understanding that we're going to be transferring patient XYZ to your hospital. This is what the clinical impression is. They tend to move to the front of the line in the ER or go straight into surgery or whatever needs to happen. So there wasn't much resistance because the ERs are already overburdened. And in the United States, what we're facing now is a lack of general practitioners. And so it's difficult for people to get in for those routine physicals, those routine appointments. And so urgent care has kind of filled that gap a little bit. Where we have a gap in the US is in the communication. Our electronic medical records systems don't necessarily communicate with one another. And so sometimes the continuity of patient care from place to place to place can suffer. But that's not untypical of a lot of places. So it is something that we didn't see much in the way of resistance because, again, this was consumer driven. The patients don't want to spend 4 hours in the emergency room waiting for whatever's coming up because they always go to the back of the queue if there's a more acute case that comes in. So urgent care has really helped with that. But that's been my experience. And I've worked in both ER, urgent care, and family practice. So I've been able to see 3 perspectives of that.